In this video, we're going to cover the anatomy of the tibia and fibula. Here we have our tibia. It is the wider of the two, and our fibula, which is more narrow. The tibia, I think that the proximal epiphysis resembles a T for tibia. Let's cover our tibial terms first, and then we'll cover our fibular anatomy, all of which you can see on the right side here. You'll see that our first two terms are the medial tibial condyle and the lateral tibial condyle. I'm going to bring back the femur. This is a left femur. Here's the head. Head is the medial side, which makes this our medial condyle and lateral condyle. You can see them better from the posterior side. And they actually line up with the medial and lateral tibial condyles so that you can hinge at the knee, that hinge joint. So if your two bones are together, you can use the head of the femur to kind of clue you in on medial versus lateral. However, that may not be the case because in your practical you could have the tibia just on its own. In that scenario, I look at the distal epiphysis for this. And this is a bit out of order. This structure here is the medial malleolus, and because this is medial, we know that this up here, this surface, is our medial tibial condyle, and this surface is our lateral tibial condyle. Now, because of my desk height, it's a little bit difficult, so I'm going to raise this up just a bit. So from this view, right here where my finger is, that is our medial tibial condyle. On the right-hand side of this image is our lateral tibial condyle. Now between the two, you'll see that there's a protrusion there. I'm going to put this back down. We have this protrusion called the intercondylar eminence. The intercondylar eminence, first off, intercondylar, in between the condyles. Eminence it's kind of like an emission emitted from the bone it's protruding from. This is where the ACL is going to attach. Many of you have probably heard of an ACL tear or some sort of ACL fracture, ACL injury. And so that's where that attachment is going to take place. Below our condyles on the anterior side, we have this round structure, and I know that the lighting kind of makes it a little bit difficult to see. I can turn it just a bit. You can see it's kind of rounded. I think it kind of resembles a button. That is your tibial tuberosity. If you've ever had the knee-jerk test done where the mallet strikes your quadriceps tendon to make you kick out your leg, this is the landmark that you feel for, and then tap the mallet just about an inch above that tibial tuberosity. Now, the tibia is a long bone, so the long portion is the tibial shaft, and the anterior surface of the tibial shaft comes to a point, and you can see it in this view pretty well. That is the anterior tibial crest. And then finally at the distal end, as I mentioned before, we have this structure that points downward. This is the medial malleolus. This is that bump on your ankle on the inside, your inner ankle bump. This is going to surround the tarsals of the foot to make up your the joint at your ankle, right? So that medial malleolus. if we bring in the fibula, here's our fibula. Our fibula is going to be affixed to the lateral side of the tibia towards the posterior. You can see this flat area. That's where the head is going to fit. So that's the head, the fibular head. And where it is a point, now some of our models have a better point than others, but this point is going to be the fibular apex. The long portion, again, is the shaft because it's a long bone, so that's the fibular shaft. And then at the bottom, it's going to affix to the tibia like that. That is our lateral malleolus. This is the outer bump on your ankle. And so the tarsal bones are going to fit into this area to make up that ankle joint.